Thanks, Buhle. About 7 months ago, renowned actress Gail Mabalane shared publicly through her YouTube channel that she had been dealing with drastic hair loss for a while. Mabalane shares the different stages of her journey, and when she eventually was diagnosed with a disease known to result in permanent hair loss for 2 years. While on the journey, Mabalane had been vigorously researching on how to find solutions to the problem and ultimately have healthier hair and a healthier skull. This week, Mabalane has launched her own hair care range, which seeks to combat hair loss. She joins us now in studio to tell us more about this journey. Gail, very good morning to you. Thank you so much for coming in to chat to us. I mean, a lot of women view hair loss as a very personal and embarrassing journey. How on earth were you able to share it? Because, you know, a lot of people are too afraid to speak about it.
Yeah. You know, it's so strange because I lost my hair in the salon. I remember sitting in the chair, sitting at the basin and getting my hair washed and then getting to the chair and the hairstylist holding the mirror up, and I had basically a hole as big as a big tomato on my head. And I immediately thought to myself, I have to share this. I don't understand where it came from because it is embarrassing. It is something that you're very ashamed of. I mean, there were other people in the salon. But I said to him, take a picture. Please take a picture because I have to share this. And I think since then, I embarked on this journey of just finding, you know, first of all, within our immediate families, I think we already know 1 or 2 women who cover up, who hide, whose hair we haven't seen in years. And so I knew that the problem was bigger than myself. I knew that this was something that needed to be talked about, and we needed to start creating platforms where women can have these open and honest conversations. Yeah.
I mean, there's a lot of descriptions. I mean, people can call it balding, people can call it alopecia. Where did your diagnosis lie as you try to find out, you know, what happened?
Yeah, so alopecia is basically just the medical term for hair loss. Yeah. And there are different types of alopecia. And I was diagnosed with CCCA, which is central centrifugal cicatricial alopecia, which is a scarring alopecia, which is very dangerous. Not dangerous, but it is scarring, which means it results in permanent hair loss. Yeah. So when you have a scar, your hair won't grow. And a lot of women ask me on my social media platforms, whether via DM or when they stop me, what did you use? How did you, you know, treat your problem? And the truth is, it's not a one-size-fits-all. It's important for you to get, you know, diagnosed properly, to go see a dermatologist, which I didn't even know when I lost my hair. That's where I needed to go. See a dermatologist, get it properly diagnosed, and then you can deal with treatment. You know, oftentimes we rush to treatment, but you haven't dealt with the core or the root of the problem. And so I was diagnosed with CCCA, and it's an ongoing journey, but I'm grateful to have the knowledge because now I know better. And, you know, for me, one of the things that's very important and that I really feel has become something I'm very passionate about is the education and the empowerment and having knowledge, because when we know better, we do better. A lot of the hair loss is self-inflicted. As much as mine is a genetic condition, it was aggravated by stuff I was doing.
Yeah, that's why it also speaks to traction alopecia.
Absolutely.
Where you braid your hair and it's pulled a lot from like very young.
Yeah.
Then eventually.
Yes, I mean, yesterday I bumped into a woman at the airport and she was very emotional because she's got traction alopecia, and you know, her hairline is receding and she's like, I don't know what to do. But she had cornrows. She had braids and they were tight, you know, they were fresh. And there's nothing wrong with braiding and you know, obviously as women we want to look nice. There's nothing wrong with it. It's just the knowledge on knowing how far you can push it, when to take a break, when to remove the braids, when to go for a treatment, and maybe not this hairstyle and that hairstyle. And I think with that knowledge comes then the opportunity to make better hair choices.
And the treatment process, I mean, the big how that everyone is waiting for you to talk about. It's internal and external.
100%. Part of going public was, this is not something I want to hide, because if I hide it, I probably will lose more hair. Because now I have to cover it up, and my scalp won't breathe because now I have to wear a wig. And then there's the embarrassment and the shame and all these things that come with just internalizing our pain, which affects our physical bodies.
Yeah.
So I decided, no, number one, I'm going to go public because I want to sit comfortably in a salon without anyone going, what's going on? And then secondly, I consulted a dermatologist, which I think is extremely important. You need to know why you're losing hair. Is it genetic? Is it stress related? Is it postpartum? Why are you losing your hair?
Yeah.
And then when you know that, you can then get the proper treatment. You know, I got different types of treatments. I mean, I get, you know, from steroids to topical creams, but it's very specific to me and how far my alopecia had, you know, where I was in the hair loss process. Some people don't need it and they just need a topical cream. So that's why I always will say, you know, get it properly diagnosed, because there's no point you're stimulating hair growth, but you're not but your scalp is not healthy enough for hair to grow. And that's the process I went through. I shaved all my hair off and started from scratch, got the treatment, and then I embarked on this journey on trying to find products that supported my regrowth process.
Yeah, and the product combination in terms, I mean, we hear use coconut oil, use castor oil, use Jamaican. I mean, there's a whole
there's a lot,
a whole batch of things. Where did you look in terms of what supports our coarse hair and the types of textures?
So, I mean, I knew that I was going to have to stay away from chemical. So I needed then to find a product that was not only going to treat my scalp and clean my hair, but also I don't like my hair to be hard. I want my hair to be softer so I can manage it better. So I tried tons of different products that would also support the regrowth process, not just the hair itself, but also my scalp, create a healthier scalp. And you know what I learned is, obviously also with now where we're at, our foods don't contain the nutrients that they used to. So we also have deficiencies, you know, in what we consume. And it was important for me to then start the process from the inside out. And, you know, I you know, together with a team of experts, created a vitamin, you know, a vitamin supplement which helps healthy scalp, healthy nails, healthy hair, and then stimulating the regrowth of hair because the scalp is just healthier. But then also finding the right products that wouldn't cause further damage or that would support the regrowth. And it's not always easy, and I think it's such a personal thing. Hair products are a very personal thing. I mean, some people prefer this, other people prefer that. But there are a lot of products that can aid, you know, in just creating a healthier scalp. I mean, I know that products that are paraben-free, sulfate-free, you know, those kind of products are important because you're just causing less damage to your hair.
And, I mean, we've spoken about the self-inflicted sort of reasons why you're losing hair, but there are other factors, like as a pregnant woman, you have a lot of hair, the estrogen levels are good, and, you know, the hair's producing, and it all looks amazing up until the sad point where you give birth and discover that your hair isn't growing as it used to, and it's thinning. And if you're not used to having thin hair, then you're forced to look for alternatives. I mean, what does that process entail when somebody gives birth and then now has to deal with this hair loss?
And for me, that's why it's important to consult, because I think what happens with us, especially in our black communities, we go to a salon and we form these little private groups and we self-medicate even. Because as much as the hair loss can be self-inflicted, we also have this habit of self-medicating where it's like, so-and-so says, no, wash your hair with this, so-and-so says, no, drink this. But until you know why you're losing hair, you can't, it's not a one-size-fits-all. So I will always advocate for getting professional help, you know, seeing a dermatologist, because even with postpartum hair loss, a dermatologist you can check blood levels to see what the issue is. You can check if it's a scalp issue, you know, if it is something that needs to be treated on your scalp, or you need to just take a vitamin supplement. So you can't diagnose someone by just looking at them and saying, oh, you've got postpartum hair loss, here, take this. You know, what are the other factors? What is it that's causing your hair loss? You know, and so it's such a personal thing. It's not a one-size-fits-all pill. So even in the regrowth and in encouraging women to know what it is that they need to supplement or to increase the rate at which their hair grows back. Because with me, with CCCA, once there's a scar, it doesn't go back. The follicle dies. So the aim is to get to the treatment before the hair follicle dies, so that you can prevent the permanence of the hair loss.
I see you have a full head of hair now. It looks amazing.
Thank you.
Perfect hairline. Where are you? At what stage are you with your treatment, and how far have you come?
So I lost my hair about 3 years ago. And embarked on this journey. It's a never-ending process, because you do something, you braid, and then your hairline recedes, and then you have to... Now I'm staying away from braids because it's not working for me. But it's also I've become so in touch with my scalp, with my skin. So I can literally feel, okay, there's inflammation coming, or whether it's stress-related or whatever the case might be, but you can start becoming sensitive to what's happening. So I went through the process of treatment, and then I just started becoming very conscious of the products that I'm using. And even in formulating this product that, I've recently launched, it was important for me to formulate a product that came with just important education lessons, because I know better. There's certain things I won't do to my hair now because I have more wisdom compared to, back when I didn't have the knowledge.
Amazing. Thank you so much. Thanks for coming in to talk to us about a very important topic.
Yeah, and also just to encourage women to have the knowledge and to have the information. Ethnogenics, that's what we stand for. That's what the brand is about. And, we're available in click stores across South Africa. It's accessible to women, and just encouraging women to say, take it into your own hands and have the knowledge and be empowered to make better choices.
Absolutely. I mean, I like the part where you say, every scenario has its own solution. It's not a one-size-fits-all sort of solution. Yeah, thank you so much for chatting to us. That was actress, media personality, and businesswoman Gail Mabalane speaking about a new initiative when it comes to hair and tackling the problem of balding, alopecia. And, of course, we leave it there for now. Let's now remind